Hello and welcome to Lyra Nara. In this video we're going to talk about respiratory diseases such as bronchitis, asthma, coughing, etc. And we're gonna discuss everything you need to know about them, the causes, the symptoms, and of course some natural remedies and supplements and other ways that will help you keep your respiratory tract in order and in well functioning. But before we do all that, just a quick reminder that we still have the biggest sales action of 2019 going on. Until the end of the year, you can get some of the most powerful holistic health devices at unparalleled prices. Take advantage, link in the description box below for you. So, without further ado then, let's get right into it and learn more about respiratory diseases. Let's start then by discussing the respiratory tract. So the cells of the human body require a constant stream of oxygen to stay alive, and the respiratory system provides oxygen to the body's cells while at the same time removing carbon dioxide, which is a waste product that can be lethal if allowed to accumulate. There are three major parts to the respiratory system: the airways, the lungs, and the muscles of respiration. The upper airways include the nose, mouth, pharynx, larynx, trachea, bronchi, and bronchioles that carry the air between the lungs and the body's exterior. The lungs act as the functional units of the respiratory system by passing oxygen into the body and carbon dioxide out of the body. And finally, the muscles of respiration, including the diaphragm and intercostal muscles, work together to act as a pump, pushing air into and out of the lungs during breathing. And the lungs, of course, are a pair of large spongy organs found in the thorax, lateral to the heart and superior to the diaphragm. Each lung is surrounded by a pleural membrane that provides the lung with space to expand, as well as a negative pressure space relative to the body's exterior. The negative pressure allows the lungs to passively fill with air as they relax, and the left and the right lungs are slightly different in size and shape due to the heart pointing to the left side of the body. The left lung is therefore slightly smaller than the right lung and is made up of 2 lobes, while the right lung has 3 lobes. The interior of the lungs is made up of spongy tissues containing many capillaries and around 30 million tiny sacs known as alveoli. The alveoli are cup-shaped structures found at the end of the terminal bronchioles and surrounded by capillaries. The alveoli are lined with thin, simple squamous epithelium that allows air entering the alveoli to exchange its gases with the blood passing through the capillaries. And your respiratory tract can be affected by a whole list of respiratory diseases, as you can see here. In this video, we're going to concentrate on bronchitis and asthma, two very common respiratory conditions that affect millions and millions of people. So let's start by talking about what affects the bronchial mucosa. The bronchial tubes branch from the trachea into 2 main bronchi, from where they subdivide inside each lung into numerous small ducts called bronchioles. The main function of the bronchi and bronchioles is to carry air into the lung alveoli, where oxygen and carbon dioxide are exchanged during respiration. The bronchial mucosa consists of squamous epithelium that originates from the ectoderm and is therefore controlled from the right temporal lobe, which is a part of the sensory cortex in the brain. The control center is positioned exactly across from the brain relay of the laryngeal mucosa. The biological conflict or trigger that is linked to the bronchial mucosa is a male territorial fear, so worry, conflict, or a female scare-fright conflict, depending on a person's gender, laterality, and hormone status. A territorial fear conflict refers to a threat to the territory, a fear within the territory, which can be at home, at work, at school, even at the playing ground, in kindergarten, in a senior's home, in the hospital, in your village, city, or country where you live. And to a fear can also relate to a fear regarding one's own safety as well as the safety of the pack in the territory, which is a female nest conflict. Also physical abuse, family violence, mobbing, bullying, an accident, fire or flooding, an acute medical condition, a frightening diagnosis or prognosis, scary medical procedures or hospitalization are a few examples of what can trigger such a conflict. Children can also suffer the conflict when they are punished, abused, or yelled at, when they are terrified of a person or a situation, when they watch spooky films or videos showing monsters or vampires, something that causes nightmares. Even unborn children can experience such a conflict in the womb when the mother is in danger or at birth during a difficult delivery. The conflict could also concern a member of the territory, for example, a fear of losing a partner who secures a home, or when a loved one is seriously ill, hospitalized, or diagnosed with a lethal disease such as cancer. And a territorial fear can be shared also by people of large regions, for example, during a natural disaster, during war times, or through scares of terrorist attacks or pandemic fear-mongering. For example, of the swine flu, AIDS, SARS, etc. As with any type of psycho-emotional conflict, the bronchial mucosa condition goes through a conflict active phase and a healing phase. During the conflict active phase, there is an ulceration in the bronchial mucosa proportional to the degree and duration of the conflict. The biological purpose of this cell loss is to widen the respiratory passageway so that more air can reach the lungs. The enhanced function of the lung serves to facilitate a conflict resolution, and there are no symptoms in the conflict active phase. During the healing phase, the tissue loss is replenished through cell proliferation, and healing symptoms are pain due to the swelling caused by the edema, so the fluid accumulation, tickles in the lungs, itching or pruritus is also characteristic for any healing involving the squamous epithelial tissue, such as the skin, and coughing. Coughing actually facilitates bringing up the phlegm that contains remnants of the repair process. In conventional medicine, the cell proliferation or the cells replenishing that takes place in the healing phase is often wrongly diagnosed as a bronchial cancer. Bronchitis occurs when healing is accompanied by an inflammation, typically with fever, headaches because of the swelling in the corresponding brain relay, and fatigue since the autonomic nervous system is in a state of prolonged rest, so in the vagotonia state. In conventional medicine, recurring bronchitis is generally associated with allergies or bronchial asthma. The swelling in a bronchial tube can block the air passages, then the result thereof is a bronchial atelectasis. On a lung X-ray, the bronchus, void of air due to the obstruction, appears as a white spot, as you can see here in the X-ray in the bottom right, and after a while the bronchial tube reopens accompanied by heavy coughs and sputum production. However, when the repair process is continually interrupted by conflict relapses, the scar buildup eventually hardens, with the result that atelectasis remains. And this is also referred to as COPD, or chronic obstructive pulmonary disease. The bronchial constriction causes permanent breathing difficulties even after the healing phase has been completed. Next, let's discuss the bronchial muscles. The wall of the bronchi and bronchioles consists of an epithelial mucosa and a layer of smooth and striated muscles. The function of these bronchial muscles is to alter the lumen of the bronchial tubes to increase the airflow during breathing. The striated part of the bronchial muscles originates from the new mesoderm and is controlled from the cerebral medulla and the motor cortex. The smooth bronchial muscles are of endodermal origin and controlled from the midbrain. Like the intestinal muscles that move the food morsel along the intestinal canal through a peristaltic motion, the smooth bronchial muscles facilitate the flow and elimination of the air morsel, so exhaling in this case. The intake of this air morsel, the inhaling process, is supported by the smooth laryngeal muscles. Inhaling is controlled from the bronchial muscles relay, which is on the right side of the motor cortex, while exhaling is controlled from the laryngeal muscles relay on the left side of the motor cortex. Normally, these two breathing motions are in balance, and this changes if a biological conflict involves one of the two brain relays or both. The biological conflict linked to the bronchial muscles is the same as for the bronchial mucosa that we've discussed, namely a male territorial fear conflict or a female scare-fright conflict, depending of course on a person's gender, laterality and hormone status. The distinguishing aspect of the conflict related to the muscle tissue is the additional distress of not being able to escape, not being able to react, feeling rooted to the ground, petrified, or feeling stuck. During the conflict active phase, there is a cell loss and necrosis of the bronchial muscle tissue that is controlled from the cerebral medulla and proportional to the degree of conflict activity, and increasing paralysis of the bronchial muscles which are controlled from the motor cortex. The paralysis causes breathing difficulties, explicitly difficulties inhaling. Exhaling is extended because of the reduced function of the bronchial muscles that control inhaling as well. What about the bronchial asthma then? Well, during the healing phase, the bronchial muscles are reconstructed and the muscle paralysis reaches into the first healing phase, manifesting with coughing fits, with bronchial spasms and convulsions, equivalent to a focal seizure. And here codeine-containing medication can suppress the coughing. Usually the coughing is dry, however, often the conflict affects both the bronchial muscles and the bronchial mucosa, which has the advantage that the combination facilitates a faster expelling of mucus from the bronchi. This condition is referred to as spastic bronchitis, and whooping cough, also known as pertussis, is also such a combined healing process related to the laryngeal muscles. In the second healing phase, the function of the bronchial muscles returns then to normal. Recurring symptoms or an allergy cough are brought on by conflict relapses that are triggered by setting on a track that was established when the original conflict took place. And the bronchial asthma involves two biological special programs. The first one is the conflict activity corresponding to the brain relay of the bronchial muscles in the right temporal lobe related to a territorial fear conflict or a scare-fright conflict, depending, as we've discussed, on a person's gender, laterality and hormone status. Second, a conflict activity corresponding to a brain relay in the left temporal lobe. Here a scare-fright conflict or a territorial fear conflict. It can also be a sexual conflict or territorial loss conflict, an identity conflict, a territorial anger conflict, female marking conflict or male territorial marking conflict, again depending on the gender, laterality and hormonal status. In this case, the person is in a bronchial asthma constellation or in a status asthmaticus when the smooth and striated bronchial muscles take part in the asthma crisis. Besides governing the respiration, the lungs, together with the spleen and the kidneys, are also in charge of the body's water metabolism. The lungs receive refined fluids from the spleen and distribute them to the body's skin and the body's mucous membranes. Creating a protective coating of the mucous membranes is essential for protecting the body from external pathogens. Thus, the lungs determine the state of the person's overall immunity and health, as well as life power. If the mucous membranes are not well nourished, one will be prone to frequent colds and have either dryness or excess mucus in those membranes. And as the lung also open into the nose, such disharmony will also manifest with nasal congestion, sinus problems, and all types of lung and bronchial conditions. As the lungs control the skin and the hair, this disharmony will also manifest in dry, rough or dull skin and hair. On the other hand, people with healthy lungs have strong immunity, radiant skin, and shiny, silky hair. The emotions associated with the lung are grief and sadness. A long time unresolved or repressed grief contracts the lungs, thereby interfering with their function to disperse energy, nutrients, and water mist throughout the body. Thus, the lungs become congested while the body remains undernourished. Usually, people with lung problems have some unresolved sadness that needs to be addressed and transformed. And since the lung is responsible for unifying and dispersing energy and nutrients, the emotional equivalent of this healthy physical function would be gathering and letting go. People with healthy lungs are unified, centered, and effective at what they do, but also can let go of everything that is unpractical and needless. On the other hand, people with weak lungs have difficulties letting go and manifest excessive attachment to people, things, events, or emotions. Let's also discuss coughing. So the invasion of the exogenous pathogenics. Exogenous pathogenic factors attack the lungs through the mouth, nose, or skin, leading to dysfunctions of the lungs that always cause coughing. The pathogenic factors may change from one to another if the treatment is improper. When the cough of exogenous origin continues for a longer period, other organs may be also impaired, and the dysfunction of internal organs can become the major cause of the cough instead of those exogenous factors. Then we also have impairment of the internal organs. The coughing can be caused by the dysfunction of internal organs, which may originate from either the lungs or other organs functionally linked to the lungs. For example, an emotional upset may impair the liver, causing stagnation of the liver qi with the production of excessive fire attacking the lungs. Or immoderate diet and drinking can impair the spleen and lead to the disturbance of food digestion and fluid transportation with sputum accumulation in the lungs. Or lung disorders can weaken the lungs and to render the lungs incapable of sending lung qi downward, resulting in adverse ascending of qi. Also, hypofunction of the kidneys can lead to an accumulation of fluid in the lungs, with an inability to regulate inhalation that may also cause adverse ascending of the lung qi. In cases due to the impairment of internal organs, phlegm and fire, so inflammation, infection, and fever, are two agents closely related to the pathogenesis of coughing. There are two kinds of sputum, i.e. cold sputum and hot sputum, and two kinds of fire, i.e. excess fire and deficiency fire. Prolonged retention of sputum may produce fire, and in turn fire can produce sputum by acting on the body fluids. In TCM, fire is inflammation, infection, and fever. When it comes to bronchitis, it often manifests with dryness symptoms such as a dry skin, dry lips, dry nose, dry throat, dry cough, hoarse voice, constipation, unresolved dry cough symptoms, productive barking cough, thick yellow-green sputum, and fever. External dryness relates to the season autumn, and besides this season, living in a dry environment such as deserts may also cause external dryness attacks. Dryness consumes body fluids, causing dry skin, dry lips, dry nose, a dry throat, constipation, etc. And dryness enters the body through the skin, nose, and mouth. As the nose and the mouth are the orifices of the lungs, external dryness attack results in dry coughing. As the throat is dry, the voice can also become hoarse. The large intestine is also the partner organ of the lung, and therefore dryness in the lung will lead to a dryness in the large intestine, and that can lead to constipation. The antidote to dryness is of course moisture, and foods that quickly moisten dryness are white foods with moisturizing quality such as eggs, milk, dairy products, turnips, onion and garlic. Pears benefit constipation, bananas and apricots have general moistening properties, and white button mushrooms also moisten and nourish the lungs. Unresolved dry cough often turns into bronchitis, and in such cases the cough becomes barking and productive, and there may be yellow-green sputum. There may also be fever. In this case, the use of moistening foods should be discontinued, and drying or cooling white foods and herbs should be used instead. Such foods as white radish, horseradish and white pepper. Other foods with drying properties are celery, corn, pumpkin, rye and honey. And apples also cool down the lungs and benefit yellow-green sputum and fever. Coughing and wheezing are symptoms with various underlying conditions, such as a running nose from an externally contracted disease, also known as a common cold, phlegm in the lung, dryness in the lung, and therefore the herbs in this class should always be combined with the applicable foods and herbs that address the underlying condition of the cough. The lung benefits from substances with white color in general, and in the case of cold phlegm in the lung, when the cough is accompanied by profuse white sputum that is easy to expectorate, white foods with a hot nature will benefit the condition. White foods with hot nature are, for example, garlic, every member of the onion family, and white pepper. In the case of hot phlegm in the lung, the heat has thickened the phlegm, making it yellow or green in color and more difficult to expectorate, causing cough which sounds like a barking. In such instances, white foods with cold nature are appropriate, such as all types of radishes, white mushrooms and turnip. For cough due to a runny nose from a common cold, inhalation with fresh ground onion is very beneficial. The onion is cut into large pieces and put into water to boil, and when the water starts boiling, the heat of the oven is reduced and the steam of the liquid is inhaled through the nose. The inhalation has a great antibacterial and antiviral effect and clears discharge provoked by viruses and bacteria from the nose and the lungs. It is also very beneficial for sinus infections. And there are also some natural supplements that are recommended, L-carnitine for example and L-arginine, 2 to 4 grams per day, OPCs or grapeseed extract, 3 capsules per day, vitamin D3 and together with K2 for better absorption, 2 capsules per day, and vitamin D3 should have 50,000 units. Vitamin C is also good, 4,000 milligrams per day in 2 to 3 portions. Magnesium glycinate, 3,000 milligrams per day. MSM or STS, sulfur. Also there are some great teas such as rose blossom, coltsfoot, horehound, Scots pine needle, lungwort, agrimony, sage, plantain and anise. You can also drink lukewarm goat milk. You can, if you want to go the homeopathic route, you can take Senegal. Breathing exercises work also well. Walking in the sun is great, especially when you do this close to the sea or ocean, because the salty air is very beneficial for respiratory conditions. You can also, if you're not close to the sea, perform inhalations with saline water, and you can also add some drops of eucalyptus to it. DMSO is also great, ultra pure, as with our unique Herbeso line of products. that are composed of natural herbs and ultra pure pharmaceutical grade DMS. So if you're interested in the Herbesso products, by the way, give us a call 1-888-773-3196. I'm also going to post the contact information in the description box below for you. And you can also take ephedra to stop coughing attacks. Let's discuss some of the herbs that can help you with your bronchitis. The symptoms of a bronchitis is a persistent and or violent cough with or without phlegm, of flu and cold included. And the treatments for coughing, pertussis, bronchitis, common cold and influenza are the following. Herbs that help you are RX bupleurum, RX cutularia, CX mori, which stops cough and wheezing, RX platycodi, FR gardenia, RX licorice, CX lisi, RX stemonae, and SM chicosanthis. And due to lungs heat and dryness, you can make a decoction of Perilia with RX ophiopogonine and Fall eribotriae. Take the decoction 1 dose per day for 15 consecutive days. If your cough is associated with pain and spasms like abdominal pain, irritability, slight chills, spasms of calf muscles, cramps in the hands, weak legs, wheezing, coughing, hiccup, constipation, vomiting, sciatic pain, severe muscle spasms in your stomach, bronchi, gallbladder and uterus, shoulder pain, pulling pain in the head, body and limbs, you can make a decoction of Paeonia and Glycyrrhiza, which is better known as licorice. And due to the spasms on the trachea, when you have symptoms such as an absent-mindedness and extreme feelings of sadness with an urge to cry, an inability to control your emotions, you're suffering from depressions, a restless sleep, night sweats, a lack of mental focus, abnormal speech, frequent yawning, insomnia, and are oversensitive, you can make a decoction of licorice, jujube, and Triticum levis. There is also a whole range of homeopathic remedies for bronchitis. Let's go through some of the most important ones. First on the list, Bryonia alba. It is the top natural homeopathic medicine for treating bronchitis and is mainly used when the cough is dry. Mucus is very difficult to cough out and may be also rusty colored, and Bryonia alba can also prove very useful for treatment of severe chest pains during coughing. The patient usually feels relief by taking rest and gets worse when in motion, and the patient may also show an increased thirst. Phosphorus is another great homeopathic remedy for bronchitis. The patient especially indicated when the patient has a dry cough and the cough is renewed by laughing and talking. Also when cold air usually worsens the cough. Excessive heat in the chest could be another accompanying symptom, and also indicated when a patient complains of tightness, heaviness and oppression of the chest, along with chest pains. Also when the mucus, when expectorated, is blood-stained, and when the patient has also a craving for cold drinks, ice cream and juices. Next on the list is the antimonium tart. It's very effective for bronchitis when the bronchial tubes are overloaded with mucus. The mucus rattles also in the chest, and the mucus cannot be coughed out with ease, and if you manage, the quantity is meager. Antimonium tart is of great help also in emptying the bronchial tubes by aiding the expectoration of the mucus present in the bronchial tubes. Spongia tosta is recommended for patients presenting with dry cough and complete dryness of the air passages. Also when there is a total absence of any mucus rails in the chest. Here mainly warm drinks can provide relief to the patient, and the patient also complains of chest oppression, weakness and difficulties breathing. Ipecac is great for bronchitis with a constant cough and a rattling of mucus in the chest. Even constant coughing does not seem to help in expelling the mucus from the bronchi, and ipecac helps in expelling the mucus out with the least effort. An important feature for using this homeopathic remedy in bronchitis is vomiting with coughing, providing some relief here to the patient. Then we have Calimur and Calisulf. They are indicated for bronchitis when the mucus rattles in the chest and the patient needs to put a lot of effort to cough it out. Calimur helps as an ideal expectorant, and the homeopathic medicine Calisulf is the best choice for natural bronchitis treatment when a yellow-colored mucus is spitted out. Also, Pulsatilla is the ideal herbal medicine for bronchitis when the green mucus is spitted out. You can also take belladonna and Rus tox. They are important homeopathic remedies for bronchitis when the bronchitis is accompanied by fever. Belladonna is the top natural homeopathic remedy for fever when extreme heat in the body is present, and there is usually also an absence of thirst. Then we also have Silicea that gives good results when chill and shivering are present with the bronchitis. Homeopathic medicine Rus tox is also prescribed when the utmost body aches accompany fever in bronchitis. Next, let's discuss some herbs that help you with your asthma or spastic bronchitis. The general symptoms of bronchial asthma are wheezing with productive cough, dyspnea, panting, yellow or white mucus that is difficult to expectorate, thick phlegm, a dry mouth with a desire to drink, a choking sensation in the chest, a sense of fullness in the chest and diaphragm, facial edemas, chills, dry stools, headaches, anxiety, dizziness, bitter taste in the mouth, that your face and eyes are red, you suffer from dry lips, irascibility, restlessness, dark urine, constipation, intercostal distension, crackling or moist rales, copious thick sputum that is difficult to expectorate, sputum that is usually yellow or white at the beginning, also a roaring sound in the throat, fever, irritability, perspiration, headache, thirst, a flushed face, and possible fever. And herbs that can help you with your asthma are RX cutelaria, RX licorice, ram cinnamon, X mutan, RX ephedra, CX mori, CX lyci, per trichosanthis, RZ bellamcandea, SM lepidi, Descurania, Ferretima, FR Schisandra, and licorice. You can also suffer from asthma due to a kidney deficiency. Symptoms for that are chronic wheezing, inhalation that is more difficult than exhalation and gets worse with exertion, fatigue, cold, feeling chilled, cold limbs, general debility, pale or cyanotic face, dark rings under the eyes, spontaneous sweating, frequent urination, oliguria, nocturia, cold knees, dizziness, tinnitus, impotence, premature ejaculation, female infertility, and loose stools. And herbs that can help you with this type of asthma are RX ephedra, SM armeniaceae, SM perilla, SM synapsis, SM lepidi, FR gladicea, RZ pinellia, CX magnolia, RX poisedani, ferretima, FR schisandra, SM raphani, per citric reticulate, CX cinnamoni, RX bleuri, RX angelica sinensis, RZ zingiberines recens, fall perillae, licorice, and FR jujube. Some homeopathic remedies for addressing your asthma are Arsenicum album, indicated when you have suffocative cough, wheezing, and a shortness of breath. Also when the asthma gets worse around midnight. Another important guiding feature for using arsenicum album is also asthma with a skin rash or eczema. Then we have Spongia tosta. That's a wonderful homeopathic medicine for asthma with a dry cough. Also when the cough in this case is deep, barking, hacking, and the cough is attended with extreme dryness of all the air passages. Also when along with a dry cough, whistling from the chest on inspiration is noted, and when respiration is also difficult. In most cases also warm drinks bring relief from the cough here. Another great homeopathic remedy is the Antimonium tartaricum. It's excellent for an asthma with excessive rattling cough. Also when the cough is loose, rattling, and the lungs feel full of mucus, and when the mucus from the lungs is raised with much difficulty. Also when respiration is rapid and difficult. And excessive suffocation is also observed. And also when the suffocation worsens when you're lying down and you feel a need to sit up. Then we have Ipecac and Sambucus nigra. Those are wonderful homeopathic remedies for treating asthma in children. Ipecac works well when there is excessive cough with mucus raised in the chest. Also when the cough is accompanied by suffocation, a shortness of breath, and gasping for air. Also when the child may become blue and stiff during the asthma attack. The homeopathic medicine Sambucus nigra is indicated for night asthma episodes in children. And also a child in need of Sambucus nigra wakes up suddenly at night with cough and suffocation. Then we have Dulcamara and Natrium sulfuricum. They are very useful homeopathic remedies for asthma in damp weather. Among them, Dulcamara is the best prescription for loose, rattling, asthmatic cough in damp weather when the person must cough a long time to expel the phlegm. Natrium sulfuricum is the most helpful homeopathic medicine when you have a cough with a thick, ropey green phlegm. And natrium sulfuricum also works well where the asthma worsens around 4 to 5 a.m. Natrium sulfuricum is also among the top grade homeopathic remedies for treating asthma in children. Next we have Nux vomica. This is a prominent homeopathic remedy for asthma in winter time. Also when coughing is with wheezing and oppressed breathing that arises in cold weather. The cough may also be prominently dry in the evening and nighttime, but loose with expectoration during the day. And suffocative asthma attacks after midnight are also best treated with Nux vomica. And Nux vomica is also great for gastric asthma. Other homeopathic remedies for asthma are Blatta orientalis and bromium. They are great for asthma that is triggered by exposure to dust. Blatta orientalis is prescribed for cough with difficult respiration and pus-like mucus. And the bromium is selected when there is a cough with a rattling of mucus, suffocation, and difficulty in breathing after exposure to dust. Carbovec shows the most amazing results in asthma for aged people. Carbovec is prescribed in case of cough with a burning pain in the chest. Also when expectoration is present in the morning and the phlegm is mainly yellow or pus-like and has a sour, salty, or putrid taste. Also indicated when the cough gets worse in the evening and when there is a frequent need to take deep breaths. Also when wheezing and rattling of mucus are prominent, and it is also the medicine to use where the cough worsens as one goes from a warm place to a cold place, and it is also great for treating asthma that worsens with acidity or flatulency. Drosera rotundifolia and Coccus cacti give wonderful results when treating asthma with cough. The features that guide the use of Drosera rotundifolia are dry and highly irritating cough. The paroxysms of cough follow each other rapidly, and when talking worsens the cough. Also when there is rough scraping sensation in the throat. Drosera rotundifolia is also the homeopathic remedy of choice for nocturnal cough. Cocos cacti is indicated where the cough with much suffocation and strangling sensation in the throat predominates. And Cocos cacti also works well for spasmodic cough that ends in vomiting. Aconite napellus is an excellent homeopathic remedy for asthma that worsens with exposure to cold air. Also, when the coughing starts soon after exposure to cold air with a whistling sound in the chest, when the whistling is mainly present during inspiration or inhalation, and also when the shortness of breath and chest oppression is felt. Then we have Lobelia inflata. It's very useful for treating asthma in smokers. The person needing Lobelia inflata has difficult short respiration with cough, complains also of a pressed feeling in the chest, and also feels like there's a lump in the throat. Few persons who need Lobelia inflata also complain of a burning sensation in the chest. And before we finish up this video, I would like to mention that, of course, those are just some ideas of natural solutions. You should always consult with your trusted healthcare giver, or you can also give us a call, of course, 1-888-773-3196. We will discuss with you in depth what is best for you. Our concept in all therapies is to deal with the physical, the bioenergetic, the level, and the informational, psycho-emotional aspects. The idea behind is that every disease is a meaningful biological process to help us solve psychogenic issues and improve our life quality and get better overall. So we follow a holistic concept. And while the physical level can be extensively treated, the energetic level, of course, must be also addressed. And only this will allow cells to regenerate and heal, and it is necessary to restore their bipolarity with the effect that the permeability of the cellular membrane will increase. The nutrients can penetrate better the cells, and the cellular metabolites can be easier excreted, and this means that the cells are not starving and do not degenerate or become toxic. There are some great devices that we recommend to achieve the fastest and best results, and here especially recommended are galvanic therapy devices such as the Ionotrans Expert and the Essential Ionotrans. Both, by the way, still until the end of the year at amazing prices available at lyranara.com. Link in the description box below. Take advantage. Those are great devices not only for respiratory tract conditions but other conditions as well, even cancer. The trigger also of any health condition, as we've discussed in this presentation as well, is often a psychogenic conflict, a biological conflict, and therefore no disease can be completely and irrevocably cured as far and as long as the biological underlying conflicts are not resolved and neutralized. And there are different techniques that we use for this psycho-emotional release, like EMDR, affirmations, and sound therapy. For some affirmations, for example, that are recommended for bronchitis and asthma are: everywhere and at any time I am fully safe and divinely protected. I get always enough air to breathe and everything I need for my life. Life is wonderful. I accept what life throws to me with dignity, tolerance, and hope. The rough events belong to one's life. I accept this and I will integrate them into my life and make the best out of them. I'm open up for surprises. Life is always wonderful and I have lust to be alive. The worst as of today is the best of tomorrow. I am never alone in this universe, though nobody can abandon me. The universe means always good with me. I love, appreciate, and respect myself. and I accept my healing and allow my body to repair, restore and rejuvenate my lungs, bronchi and the whole respiratory system. And with all that being said, I hope that you've enjoyed this presentation. If you have any questions or you need personal advice, as I said already, please do not hesitate. Give us a call, 1-888-773-3196. We are here to help you and guide you along your path to complete health. If you've enjoyed this presentation, please also support this channel by liking, sharing and subscribing. Hit also the notifications button so you don't miss out on the weekly holistic health content that appears on this channel. And again, take advantage of the biggest sales action and get some of the most amazing holistic health devices at heavily discounted prices until the end of the year. Link in the description box below. With all that, stay healthy. Until next time.